Good afternoon, Senator. Please proceed.
Thank you, Mr. Chairman, committee members, colleagues. A few of us started off this year with a press conference in Skid Row in Los Angeles, and we were supporting President Pro Tem Kevin DeLeon and his immediate predecessor, Darrell Steinberg. And the topic was Prop 63, that we could use some of Prop 63, the Mental Health Services Act, to provide revenues to pay for housing for the mentally ill homeless. And at that time, I thanked President Pro Tem Darrell Steinberg, our former President Pro Tem, for one, authoring Prop 63, but two, for also authoring Senate Bill 585 in 2013, which now allows Prop 63 money to be used for the implementation of Laura's Law. And I shared my intentions with him at the podium to do something similar this year. And that's what we have before us, colleagues. So I just want to say at the beginning that contrary to the committee analysis, which concludes that it is unclear if this bill is needed, I'm here to tell you that it is definitely needed and it's necessary and critical. Excuse me. Proposition 63 and the resulting regulations does not provide a clear understanding on if money can be used for outpatient crisis stabilization services that are designed to work with both voluntary and involuntary patients. Senate Bill 1273 is a simple clarification that the Mental Health Services Act funding can be used for programs that collate voluntary and involuntary services. So I want to thank the committee chair, and the staff for all of their hard work on this bill, and I accept the amendments that were agreed to. As stated in the support letter from the County Behavioral Health Directors Association, CSAC, and the Urban Counties Caucus, this bill would provide counties additional flexibility in the use of the Mental Health Services Act for funds for outpatient crisis stabilization services. In the County of Orange, with some 3.1 million residents, we have very few rooms to provide for mental health crises. In Orange County in 2011, we had a tragic homeless person who was schizophrenic. His name was Kelly Thomas, and he was killed in the city of Fullerton in a tragic incident with the Fullerton Police Department. After that, we had mental health advocates come to the Orange County Board of Supervisors and come to our podium and say, you know, if you would have had Laura's Law in place, maybe Kelly Thomas would be alive today. So we pursued Laura's Law, which was AB 1421 by Helen Thompson from Yolo County, a wonderful lady who based the law on Laura Wilcox, who was murdered in Nevada County. And Nevada County adopted Laura's Law, but no other county did. So I was chairman of the Orange County Criminal Justice Coordinating Committee, and so we met every month, the healthcare agency, the sheriff's department, the district attorney, public defender, the presiding judge of the court, the presiding judge of the juvenile court. We had the probation chief, and we worked and said, how can we get Laura's Law implemented in Orange County? And the more we worked on it, the more we agreed that we should, the more we also realized we had no money. We were going through an economic recession and could not locate the necessary funds to implement the program. So I met with then President Pro Tem Darrell Steinberg and said, we need to be able to use a little bit of Prop 63, and if you can allow for that, then we can fund Laura's Law. And so Senator Steinberg put together Senate Bill 585, and it was approved by the legislature and signed by the governor. And I bumped into Darrell one day flying to Sacramento, and he was on the plane, and it turns out he has a brother, a rabbi in Irvine, California, and he looked at me and says, if I get 585 approved, will you adopt Laura's Law? And I said, yes, we will. And sure enough, Senator Wynn and I and Senator Bates, two other colleagues, unanimously voted for Laura's Law. We became the second county in the state to adopt Laura's Law, 12 years after Helen Thompson's bill was approved. And so it was quickly followed by counties like Yolo, Placer, San Francisco, Contra Costa, Mendocino, Los Angeles, San Diego, and just last month, Ventura County. So I think Senate Bill 1273 will have a chance to provide another tool for counties in their toolbox to be able to approach the mental health crisis that we are facing Our emergency rooms are overburdened, and when individuals come in for a mental health crisis, they don't stay for an hour or two. It could be days. And so we need to be able to help them. And when we have emergency rooms that are overburdened, our police departments are having trouble. They drive from hospital to hospital to find a location to help the person that's impacted. And that takes up a lot of public safety time. So then we do a disservice if we put them in a location that's there designed to do triage instead of psychiatric therapy. So we need to remove the ambiguity. If a law is not clear and it's not specific, what we find is that county council comes to us and says, you can't adopt it because it isn't specific, and then we're kind of stuck. But once we make it specific, like we did with Senate Bill 585, we started an ability to help a lot of people in this state. So I am honored today, colleagues, to have so many healthcare providers in support of SB 1273. They certainly understand the necessity of having something very clear. I'm honored to have the endorsement of Darrell Steinberg and the Steinberg Institute. I'm honored to have Senator Robert Hertzberg's co-authorship, as well as many of my Republican colleagues as co-authors. And we just want to stop the ambiguity, make it very clear, and this will provide an option that will address a significant need, and I respectfully request your aye vote. Today, I'm honored to have witnesses. I have Mary Adair, Deputy Director, the Legislative Affairs for the County Behavioral Health Directors Association. I have Anna Hasselblad, Director for Public Policy at the Steinberg Institute, and Dr. Paul Yost from Allied Anesthesia.
Good afternoon, Chair and members. My name is Anna Hasselblad from the Steinberg Institute. The Steinberg Institute is dedicated to advancing sound public policy and inspiring leadership on the issues of mental health. SB 1273 clarifies for counties that Prop 63 funds may be utilized to provide crisis stabilization services, including crisis intervention and stabilization for a person suffering acute symptoms of distress, crisis residential treatment, rehabilitative mental health services, and mobile crisis support teams. We appreciate the amendments, which provide further clarity on the ability to co-locate voluntary services funded by Prop 63 with involuntary mental health services to establish a broader spectrum of care. This will allow for more seamless transitions in care, especially for step-down care as an individual in a severe mental health crisis begins to stabilize and recover. This will serve to help treat the whole person in a client-centered way. There is a very real need for additional crisis care services in California, especially in light of the 22% decrease in the number of acute psychiatric beds in California hospitals from 2004 to 2013. Emergency rooms and county jails across the state are seeing the number of people who are in a mental health crisis rise dramatically in their facilities. At the same time, there is a distinct lack of more appropriate community-based services to divert them to. This must change. SB 1273 will create clear authority for counties to invest Prop 63 funds within community supports and services for triage, crisis intervention, and stabilization, and co-locate those services with separate and more acute kinds of care. Thank you, and I respectfully ask for your aye vote.
Mr. Chairman and committee members, my name is Mary Adair, and I'm with the County Behavioral Health Directors Association. First, we want to thank the Senator and his staff for working with us to address some earlier concerns we had with the bill. We're now in support of the bill, and this simply provides authority for counties to use Proposition 63 funds for the funding of outpatient crisis stabilization services. This will provide us with additional flexibility to treat consumers as appropriate in these settings rather than emergency departments. And crisis stabilization services are particularly in high demand right now, with increasing demands for services with people with a range of mental health needs, including the needs of the homeless. For these reasons, we support SB 1273. Thank you.
Thank you, and thank you for listening to me. My name is Dr. Paul Yost. I'm a former board member on Cal Optima, where I served with Senator Morlock for 4 years. I served on the board for 8 years, he for 4 of them. I'm also former chief of staff of Shock Children's Hospital in Orange County, also immediate past president for the California Society of Anesthesiologists, board member for OCMA, and I'm speaking on behalf of OCMA in support of this particular measure. And just a couple of comments that I would like to make. You know, Shock Children's, we opened our emergency room and just recently, and we were designed for 60,000 visits a year. We're currently on a pace to do 90,000 visits per year. And in speaking with the director of the ER, when someone comes in mental health crisis, they stay in the ER from an average to 1 to 5 days in an emergency room. And that is an absolutely terrible place for a person to be in mental health crisis, that we need more funding for that. Orange County now has absolutely zero beds for children under the age of 12 in mental health crisis. CHOC has taken this on, and we are going to be opening an 18-bed mental health unit at CHOC. And we're not just depending on the state or on federal funding or in state funding or county funding for this, but the CHOC Foundation, their gala, made mental health as their focus and raised over $7 million about a month and a half ago to go for that. Not that we don't need some Prop 63 funding, not to say that, but we absolutely do. And the last comment I would make is that I think Senator Moorlach is in a particularly wonderful position to make this proposal, being an accountant, county supervisor, having been in charge of these services, and also having served on the CalOptima board for 4 years and trying to figure out ways in which to provide these services to the members of the county. So I want to thank him for writing this. I think it's a very needed bill, and thank you for listening.
Thank you, members of the committee and Mr. Chairman. My name is Randall Hager. I'm with the California Psychiatric Association, and most of my talking points have already been taken. I will add to this only one thing, is that when a person is in crisis and there are crisis services available, it prevents what would be an avoidable hospitalization. Without those crisis services, you do have unavoidable hospitalizations. So it's very, very necessary that we support these kinds of services. The CPA does, and we hope you will too. Thank you.
Anyone else in support?
Yes, Mr. Chair, members, Julian Voris here on behalf of the urban counties of California in support. Thank you.
Asha Harris on behalf of California State Sheriff's Association in support.
Farrah McDade Ting on behalf of the California State Association of Counties in support.
Tim Madden on behalf of the California chapter of the American College of Emergency Physicians in strong support.
Trent Smith on behalf of CalOptima Health Plan and support.
Thank you.
Sam Greenspan, Children's Hospital Los Angeles, Len Public Health Fellow, support.
Thank you. Anyone else?
Brian Robertson, a nursing student from Sacramento State, in strong support.
Philip Bautista, registered nurse that has worked with mental health patients and a public health nurse in California. I ask for your support. Thank you.
Miranda Dreyer, San Diego nursing student, Navy veteran, and I am in strong support.
Jessica Curtis, nursing student, California State University, Long Beach, in strong support.
Helen Cameron, Jamboree Housing, member of Orange County Mental Health Services Act Steering Committee, in strong support.
Ashley Lewis Hunter, internist and pediatrician in LA, in strong support.
Melinda Palma, pediatric resident physician at Harbor UCLA, in strong support.
Monica Foster, also pediatric resident at Harbor UCLA, also in strong support.
Tanisha Moss, pediatric resident at Harbor UCLA, also in strong support.
Support or?
Well, I don't want to do your job for you, but does anybody else support? Okay. So my name is Margaret Johnson with Disability Rights California. We support voluntary crisis intervention programs, but the very recent amendments that we've seen that I don't believe are in print, we have concerns with those and are concerned that they may allow MHSA funds to pay for involuntary hold facilities. The author has been very good about working with us, and I hope that through continued negotiations, we'll be able to work out any concerns that we have. Thank you.
Thank you. Anyone else in opposition? Questions, comments? Yes, Senator Monning.
Thank you, Mr. Chair. And I want to thank the author and all of the providers and related associations for the commitment to this important issue. But my follow-up comes from the last question. And as I read the original bill, there seemed to be quite a focus on involuntary services. My understanding is that the Prop 63 funding can already do everything else that's itemized. But if you could help the author or anyone on the panel help me understand where this bill goes in terms of using these funds for involuntary commitment?
I guess there's two components, Senator Monning. The first is it isn't clear, so that we want to at least make it clear. The second is that when you go to a facility, it will have voluntary and involuntary services at the same time. We're trying to make it clear that it's for the voluntary component, but you're going to have the same psychiatrists there at the same place. So we're trying to work on the language, but maybe.
Yes, Senator Monning. Typically, crisis stabilization units are either proximate to or attached to the involuntary treatment facility, the designated 5150 facility. Those are voluntary. At the time of a person's entrance into a crisis stabilization unit, they're there voluntarily. There may be an assessment that does say, however, that they might need an involuntary hospitalization. They would be, they would be evaluated under the 5150 statute, and if so, then they would be transferred to the facility. Prop 63 funds would not pay for that facility. So while 5150s may occur in a crisis stabilization setting, those services are not paid for on the involuntary side.
Thank you. That clarification is helpful. I think the amendments are designed to help clarify that, but a lot of the opening statement talked about Laura's Law and involuntary commitment. I respect the work you're doing on this. I think I am going to lay off today, but monitor as the bill moves forward and hope I can be supportive when and if it gets to the floor. Thank you. Thank you, Mr. Chair.
Thank you. Anyone else like to make any comments? Yes, Senator, move the bill by Senator Wolk. Comments? No comments. Seeing no comments, Senator Morlock, would you like to close?
Thank you, Mr. Chair. I emphasized Laura's Law because it was an example of how we can do something with a little creativity, and what a positive result it had. And so this is sort of a legacy opportunity where we can provide services to a significant segment of our population that has outpatient crisis stabilization needs. And so I'm very appreciative of the opportunity to bring this bill forward. I want to thank again the chair for his assistance. We want to have a location in Orange County just where we can have the police departments deliver someone and have a standalone opportunity to help people. So with that, I respectfully ask for your aye vote.
Thank you. We're at item number 9, SB.
An hour later.
1273, do pass as amended. Please call the members, please.
Hernandez. Aye. Hernandez, aye. Nguyen. Hall. Mitchell. Monning. Nielsen. Nielsen, aye. Pan. Pan, aye. Roth. Roth, aye. Wolk. Wolk, aye.
That's 5-0. It's enough to get out, but we're going to place that bill in call.
Thank you, Mr. Chair.
We're going to have item number 12, SB 1401, McGuire, Pediatric and Home Care Expansion Act. My understanding, there is support on both sides.